Hi everyone, it's Dr. Christina Bosner, the Doctor of Biohacking Supermom. Today I'm going to be sharing with you the free health testing you don't know about. Regardless if you're dealing with a chronic health condition or you're just trying to optimize your health, there's one daily action that you can take to start assessing your health. And it's looking at your stool. For those of you who don't know what stool is, it's your poop. Many people know that your stool can tell you a lot about your digestive health. So for those of you who are familiar, the consistency, shape, and size of your poo is something that most of us know to look at. And for those of you who don't know, the Bristol stool chart is a way that you can take a look at the different shapes and sizes of stools to see if your health is optimized. You can start looking at the Bristol stool chart to see where you lie. We always aim for snake-like poos. In my practice, I always tell my patients, if you're not looking at your poops every day, you need to start today. If you don't have snake-like or solid pieces of poo, if they are little pellets or it's liquid, we know there's a problem with your digestion and we know there may be a long-term problem with your health. If you're not familiar with the Bristol stool chart, we'll attach a link below for you to check. Aside from the Bristol stool chart, there are other indicators that are free that can give you deeper insight. Today, that's what I'm going to be sharing with you. The first way to delve deeper into assessing your gut health is to look at the color of your stool. What color should your stool be? Anywhere between brown, yellow, and green is considered normal. If you're starting to look and see that you have clay or light color stools, this can give you an indication that digestion is off. Oftentimes, it's an indicator of gallbladder dysfunction and/or digestive enzyme problems. If you're seeing red or dark color stools, this could be a serious problem. Certain foods can cause your stools to be red. If you've recently eaten beets or licorice, this could be the reason that your stool is red. If you haven't had either of these things in the last day or two and you're seeing red and or really dark stool, this could be an indicator of bleeding somewhere in the gastrointestinal tract, and it needs to be checked out by your doctor. Another free test that you can do to assess your gut health is to look to see if there are any undigested particles in your stool. If you're looking at your bowel movements and there are green leafy pieces of things or chunks of food, one of two things could be happening. The first reason you would have undigested pieces of food in your stool is because you're not chewing enough. Chewing is so vitally important. And if you already know that you're racing through your meals and not chewing, you probably are going to see some undigested pieces of food in your stool. The second reason that you may have undigested pieces of food in your stool is because you may not have enough enzymes, or you may not have sufficient stomach acid to turn those enzymes on to help break down your food. And this would be really important to know because you could be eating the most beautiful, healthy, whole foods, plant-based, really organic diet, and you might not be absorbing anything because your body doesn't have the ability to produce the enzymes. If this is the case, you should seek the help of a professional to help you figure out why you're not digesting your food. Another way to assess your gut health for free is to look to see if your poop is sinking or floating. Which one is normal? Normally, your stool should be sinking to the bottom. On the odd occasion, if you see a little bit of a floaty stool, it could be that you had too much fiber or too much fat that day. Like those times where the fruit is fresh and you decide to eat a whole bowl of cherries, that next day you might have a floating stool. But if you regularly see that your stool is floating, this could indicate something more serious. One of the reasons that your stool may be floating is that you're having too much fat or you're not able to digest fat. If you've recently started a higher fat diet, you may be eating too much fat at once and your body may not be able to produce the enzyme lipase to break down that fat quick enough. So what you want to do is you want to ease off and slowly introduce the amount of fat. One of the most obvious tests you can do for your stool is called the smell test. Either you and or your family members know when your stool is really smelly. Now, stool is normally smelly, but when it's particularly putrid or everyone needs to evacuate the room for a while, that could indicate some problems with digestion and some other issues. Your gut microbes, the bacteria in your gut, the healthy ones and the unhealthy ones, feed on the food you give it. If you have an imbalance of the good and bad bacteria in your gut, this could create the lack of ability to break down your food appropriately. If food isn't broken down appropriately, it can putrefy, and that ends up coming out really smelly. Another thing that I frequently notice is that for my patients who have a hard time digesting protein, either because they don't have enough stomach acid or they don't have enough of the enzyme, the proteases, to actually break down the protein, that protein will putrefy on its way through the digestive tract, and that ends up being very, very smelly as well. The third thing that could give you a really, really smelly poop is if you have eaten a lot of processed food or food that your body's having a very hard breaking down. And oftentimes you could notice that if you've been out and you've been somewhere at a party or a gathering and eaten a lot of things that you don't normally eat, you might notice that you have not only really smelly poop, but you may have really smelly gas. These are all signs from our body that something is off. So if you or one of your family members passes the smelly, smelly poop test, you might want to look deeper into figuring out what is actually causing that problem. If you know someone this can help, tag them below. For more videos like this, follow me on my YouTube channel or join my Myth Busting Motherhood Facebook group.